Assalamu alaikum everyone. Hope you're all doing fine. Today, inshallah, we're going to discuss a new topic in the nervous system module. We're going to discuss the fascia of the neck and the anatomy of the posterior triangle. By the end of this session, you should be able to recognize the different layers of the fascia encircling the neck. You should understand the clinical relevance of each layer and identify the posterior triangle and enumerate its content. Fascia of the neck is similar to fascia covering other parts of the body. We know that our skin is covering two layers of fascia. A superficial layer of fascia, which is just beneath the skin, containing a variable amount of fat to act like an insulator for underlying structures, containing nerves and vessels, superficial nerves and vessels usually supplying the same area. Whereas for the deep fascia of the body, it's usually a thin sheet of connective tissue, gathering and collecting muscle groups with each other to enhance their performance. At the area of the neck, we also have these two layers of fascia, a superficial and a deep layer. For the superficial layer, it's similar to other fascias of the body, containing a thin layer of fat. It's rather thinner than other parts of the body, containing superficial nerves and superficial vessels supplying the area of the neck, along with a subcutaneous muscle that is called a platysma. Just beneath this layer of superficial fascia, we're having the deep layer of fascia of the neck. Whereas for this deep layer of fascia, it's subdivided into subclassifications that help in performing various functions of structures present in the neck. The muscle that is called a platysma, it's a superficial muscle present in the superficial fascia, gets its origin from the superficial fascia in the thoracic region and runs upward to blend with the muscles of the face. This muscle, the platysma, is innervated by the cervical branch of the facial nerve. The origin of the platysma, as we just mentioned, it comes from the superficial fascia of the pectoral region plus the deltoid area. So it's coming from the pectoral fascia and the deltoid fascia. Its insertion is at the base of the mandible and blending with the skin of the lower part of the face and lip. The action of the muscle platysma is to pull the angles of the mouth downward, stretching the skin of the neck as in terror, fright, and horror expressions. This is a superficial dissection for the superficial fascia of the neck, showing the muscle fibers for the muscle called the platysma. As you see, it's coming from the area just at the upper part of the pectoral fascia, along with the deltoid fascia, extending upward to be inserted at the lower part of the mandible, along with the skin of the lower face and lip. This is the platysma muscle in action. As you see, the platysma muscle, its origin from downward and its insertion is upward, so it draws the upper structures towards the lower ones. It pulls upon the lower border of the mandible, pulls upon the lower lip, and gives eventually the picture for the horror expression that we are used to see. We just mentioned that the superficial fascia of the neck contains, along with the platysma muscle, group of vessels and groups of nerves, either traversing the area to go elsewhere or supplying the same area. So if we are talking about superficial content of the superficial fascia or the content of the superficial fascia of the neck, one of the important structures present would be the external jugular vein. This external jugular vein is formed by the union of posterior auricular vein and the posterior division of retromandibular. The external jugular vein descends superficial to the sternomastoid within the superficial fascia, but pierces the deep fascia in the lower part of the posterior triangle to drain eventually into the subclavian vein. This external jugular vein has got some tributaries. Among these main tributaries, the anterior jugular vein, the transverse cervical vein, the suprascapular vein, and the posterior external jugular vein. This is a diagram. We're looking at the neck from an anterior view. This is a superficial dissection of the right side of the neck. This is a deep dissection of the right side. What I'm seeing now, this is the deep fascia investing the neck, encircling the right side of the neck. Whereas these structures that are present in the side of the diagram, these represent the content of the superficial fascia at the right side of the neck. We said that the first main structure that we're looking for would be the external jugular. This external jugular is formed by union of two veins, posterior auricular and retromandibular. Both descend inferiorly to unite, forming the external jugular at the outer surface of the sternomastoid. This is the sternomastoid. Descends downward to pierce the deep fascia, as you see here, to join the subclavian vein. Among the tributaries to this external jugular vein are the following vessels. This is another diagram for the same external jugular. As you see, it's coming from the posterior auricular with the retromandibular, both uniting at the outer surface of the sternomastoid, descending downward till it pierces the deep fascia of the neck, draining into the subclavian vein. At this particular view, I might see some of its tributaries. Here I see the posterior external jugular. I might see a transverse cervical. I might see a suprascapular vein. All drain into this external jugular that drains into the subclavian vein. This is another view for the anterolateral surface of the neck. This view shows the area that we'll call later the posterior triangle. And as you see, this is the sternomastoid muscle. This is the external jugular vein present at the outer surface of the sternomastoid, going downward to be drained into the subclavian vein, as you see. At this particular picture, I can see the transverse cervical vessels coming to drain into this external jugular, along with the supraclavicular vessels and the suprascapular vessels. This is a closer look to the same area. I can see the external jugular. I can see the transverse cervical vessels draining into it. I can see the suprascapular vessels also and supraclavicular draining into the same external jugular vein. And as you see, the external jugular vein itself, just beyond the clavicle, behind the clavicle, draining into the subclavian. The external jugular vein has a particular clinical importance for measuring the central venous pressure. If someone is complaining of decreased cardiac functions, especially related to the right side, complaining of right-sided heart failure, as a consequence for the heart failure, the venous pressure at the right side of the body would be increased, and this increase in the venous pressure would cause the engorgement in the external jugular vein. As you see, this is a patient sitting in a recumbent position. He's not in a supine position, and as you see, he has got a congested external jugular vein, indicating weak functions of the right side of the heart. This patient is probably suffering from right-sided heart failure. Another content of the superficial fascia of the neck would be the anterior jugular vein. As we mentioned, we have the external jugular is present at the lateral surface of the sternomastoid. For the anterior jugular vein, they both start from the chin, just below the chin, and descend on each side of the midline, forming what we call the anterior jugular veins. These veins just above the suprasternal notch at the lowermost part of the neck, the right and the left ones, unite with each other, forming what we call a jugular arch. Each vein then turns laterally deep to the sternomastoid muscle to drain into the external jugular vein. So an anterior jugular vein would eventually drain into the external jugular vein that we just mentioned at the previous slides. This is another diagram for the front of the neck. This is, as we mentioned earlier, this would be a superficial dissection because I'm seeing the superficial veins running in the neck. As you see, this is the external jugular, this is the sternomastoid, and this is the external jugular running just upon it. At the other side, I have a split sternocleidomastoid. It's removed from the view to show the vessels just covering and just beneath the muscle. This is the external jugular. This is the internal jugular. And these would be the anterior jugular veins. We said that both would start from just below the chin in an area called submental triangle. Then both descend on the sides of the midline till they reach the lower neck. And at the lower neck, they both unite by this arch between the both anterior jugulars, and both anterior jugulars would eventually drain into the external jugular, whereas for the external jugular, it would go for the subclavian vein. For the deep fascia of the neck, because of its particular subdivisions, the deep fascia is divided into 4 layers: an investing cervical fascia, a pre-vertebral layer of fascia, a pretrachial layer of fascia, in addition to what we call the carotid sheath. For the first layer of the deep fascia of the neck, the investing cervical layer, this is the most superficial layer of the deep fascia, just beneath the superficial fascia. This layer of investing cervical fascia encircles the neck, meaning that it surrounds the neck whole through. And through its course, it splits to enclose muscles, meaning that if it starts from the most anterior part of the neck, it splits to enclose the first muscle encountered, this would be the sternomastoid, then fuses again once more, and splits again at the low and the back of the neck to enclose another muscle that is called the trapezius. The split part of the investing cervical fascia reunites into a single layer and forms the roof of the posterior triangle. The posterior triangle is an area of the neck just behind the sternomastoid. So if this is the sternomastoid and this is the split layers of the investing cervical fascia uniting together on their way to split again to include the trapezius, at the area in between both the sternomastoid and the trapezius, these two fused layers form what we call the roof of the posterior triangle. So the investing cervical fascia splits to enclose 2 muscles at the front, 2 sternomastoids, and splits 2 times at the back on both sides to enclose the trapezius muscle. This investing cervical fascia has got attachments. Superiorly, it's attached to the external occipital protuberance, the superior nuchal line, the mastoid process, along with the base of the mandible. This is the extent of the investing cervical fascia and its attachment. As you see, it's attached to the uppermost part. This uppermost part constitutes the lower aspect of the head and the face. So it's connected to the external occipital protuberance, superior nuchal line, the mastoid process, along with the lower border of the mandible. If I extend downward, it would be attached to the upper part of the clavicle and blending with the fascia of the thorax. Inferiorly, this investing cervical fascia is attached to the spine of the scapula, the acromion, the clavicle, along with the mandible, the uppermost part of the sternum. As the investing cervical layer of fascia goes downward, it splits to enclose 2 other spaces, a space called supraclavicular and suprasternal spaces. Anteriorly, the investing cervical fascia is attached to the symphysis mentae and the hyoid bone in the midline, and it continues with that of the opposite side just above and below the hyoid bone, whereas posteriorly it's attached to the ligamentum nuchae and the spine of C7. This is the anterior extent of the investing layer of cervical fascia. As you see, it extends upward from back to forwards from the external occipital protuberance, superior nuchal line, C7, ligamentum nuchae through the whole direction down to C7, then goes to the lower part of the mandible, symphysis mentae, the hyoid bone, and downward till I reach the manubrium of the sternum. The second layer of the deep cervical fascia is called pre-vertebral layer of fascia. This layer has got its name from being just present in front of the prevertebral muscles, enclosing the prevertebral muscles, the anterior, middle, posterior scalene with the deep muscles of the neck. This layer of prevertebral fascia has an anterolateral extension going into the axilla, forming a sheath surrounding the brachial artery, the brachial vein, and part of the brachial plexus, and this sheath is called the axillary sheath. The attachments for the prevertebral layer of fascia is attached superiorly to the base of the skull, extends to the superior mediastinum till its anterior longitudinal ligament of the T3 and T4 vertebrae. Anteriorly, it separates from the pharynx and its buccopharyngeal fascia by a retropharyngeal space containing loose areolar connective tissue, and laterally it's deficient below the trapezius muscle. This is a cross-section taken at the middle of the neck, showing the fascial layers that we're talking about. The first layer of fascia would be just beneath the skin. This is the superficial layer. The second layer is called the investing cervical fascia. It's colored into blue. As you see, this investing cervical fascia splits twice. Once, one of these times at the anterolateral aspect of the neck, enclosing the sternomastoid, and the other time it encloses the trapezius muscle before they join together again from the back. Just beneath this investing cervical fascia, I've got the pre-vertebral fascia. As you see, it's colored here in pink. It's encircling the prevertebral muscles, encircling the scalene muscles, and the deep muscles of the spine. This is a more specific photo for the neck. As you see, this is the trachea, this is the esophagus, this is a cervical vertebrae. I can see the transverse processes with the foramen transverse area. The layer highlighted in yellow, this is what we call the prevertebral fascia. This prevertebral fascia encloses the prevertebral muscles, the scalene muscles, and the muscles connected to the spine posteriorly. As you see, this prevertebral fascia is extending from the base of the skull superiorly till the anterior longitudinal ligament of the third or the fourth thoracic vertebrae downward. And it's separated from the back of the esophagus, but by what we call the retropharyngeal space. This retropharyngeal space is a potential space that might harbor an infection later on. The one before the last of the layers of fascia that are considered to be deep fascia of the neck is called pretracheal layer of fascia. The pretracheal layer of fascia encloses the viscera of the neck, mainly the trachea and the esophagus, along with the thyroid gland. The pretracheal fascia has got a superior attachment attached to the hyoid bone in the midline, then the oblique line of the thyroid cartilage and cricoid cartilage laterally. Inferiorly, they descend to enclose the inferior thyroid veins. Infrahyoid muscles descend into the thorax behind the brachiocephalic vein to blend with the adventitia of the aorta and the fibrous precardium. Laterally, the pretracheal fascia extend on both sides to fuse with the anterior layers of the carotid sheath. This is the horizontal extent of the pretracheal fascia. As you see, the pretracheal fascia is enclosing the viscera of the neck, mainly the trachea and the esophagus. The lateral extension for these pretracheal fascia can reach to the fascia covering the carotid sheath. This is the carotid sheath. This is the anterior surface of the carotid sheath. So the pretracheal fascia goes laterally till it blends with the anterior surface of the carotid sheath. Superiorly, it's attached to the hyoid bone, the thyroid cartilage, and the cricoid bone. Descends downward till the thorax to be attached to the adventitia of the aorta and blends with the structures present in the thoracic cage. This diagram shows the four layers of the investing or the deep fascia of the neck. We have got the deep investing layer of fascia. This is the most superficial one, just below the superficial fascia. Then we've got the prevertebral layer of fascia, the one extending from the base of the skull till it reaches the fourth thoracic or the third thoracic vertebrae. We've got the pretracheal fascia, the one connected to the hyoid bone, thyroid cartilage, and cricoid one. And this one extends downward till it reaches the thorax also and blends with the adventitia of the fibrous precardium and the arch of the aorta. So we've got the pretrachial fascia, pre-vertebral fascia. We've got the buccopharyngeal fascia, and the space between the buccopharyngeal and the pre-vertebral layer of fascia is called the retropharyngeal space, and the investing layer of fascia. The fourth layer of fascia, considered to be part of the deep fascia of the neck, is called the carotid sheath. The carotid sheath is a condensation of the deep fascia of the neck surrounding particular structures. They receive a contribution from other three fascial layers extending from the base of the skull till the roots of the neck. It's cylindrical in shape, surrounding the common carotid artery, internal carotid, internal jugular, and the vagus nerve. They all are contents within this carotid sheath, running from the base of the skull till the root of the neck downward. This diagram shows you the carotid sheath. This is an anterolateral view of the skull. This is anterior. This is the cadaver. This is the anterior aspect of the cadaver. This is the posterior one. This is the carotid sheath. As you see, it's a condensation of deep fascia coming from all three layers, investing pretrachial, prevertebral. It's cylindrical in shape, extending from the base of the skull till the root of the neck, and it contains inside this cylindrical shape the common carotid, the internal carotid artery, the internal jugular vein with the vagus nerve. Just behind the carotid sheath will be situated the sympathetic chain or the sympathetic trunk of the neck, whereas for the anterior aspect of the carotid sheath lies the ansa cervicalis. The ansa cervicalis is the nerve supply for the infrahyoid muscles. The deep cervical lymph nodes lies along the sheath, especially its thin part investing the vein means that the deep cervical lymph nodes are in close proximity for the internal jugular vein and leaving the carotid sheath in between. Again, as you see, this is the posterior triangle, this is the anterior triangle, and this is the carotid sheath extending from the base of the skull till the root of the neck. For the triangles of the neck, it has been agreed that the muscle present at the anterolateral aspect of the neck, the sternomastoid, would be an anatomical barrier between two distinctive anatomical areas. An area in front of the sternomastoid that will be called the anterior triangle. It's an inverted triangle with its base upward and its apex downward. Whereas for the area behind the sternomastoid, it's called the posterior triangle. It's a regularly based triangle with its base to the downward while its apex upward. So the sternomastoid is the anatomical barrier separating between the two spaces. This sternomastoid muscle is called sternocleidomastoid because it has got two origins. Part of it is coming from the sternum and the other part is coming from the clavicle, whereas for its insertion it's into the mastoid process. So it's called sternocleidomastoid, or short name for sternomastoid. The muscle that's called sternocleidomastoid, as we said, divides the neck into two triangles, an anterior triangle in front of it and the posterior one just to its back. It has the origin from two different places: a sternal head coming from the manubrium sterni, the uppermost part of the sternum, the back of the sternum to be precise, while the clavicular head comes from the medial 1/3 of the inner aspect of the clavicle. The insertion of the sternomastoid is into the mastoid process of the temporal bone just behind the ear. The nerve supply of the sternomastoid is through the spinal accessory nerve. The action of the sternomastoid depends upon which part or which side of the sternomastoid being called for action. If I'm calling both sides for action, then the sternomastoid will perform flexion of the neck. Okay, bending the head forward, causing flexion of the neck. Whereas if I just move one sternomastoid, it would rotate the head to the opposite side. These are the sternomastoid present at the anterolateral side of the neck. As you see, it has got two places to come from, a dual origin. Part of it coming from the back of the manubrium sterni, This is called the sternal part. Another part coming from the back of the medial 1/3 of the clavicle. This is the clavicular part, and the muscle itself extends upward till it reaches for the mastoid process just behind the ear to insert into it. As we said, movement of both muscles, both sides, causes flexion of the head, while movement of one muscle will cause the head to rotate to the opposite side. This is also the sternomastoid, and it's evident here that the sternomastoid has got two origins. One of them coming from the manubrium, the uppermost part of the sternum. The other part is coming from the clavicle. Again, the sternomastoid, this is a dead lateral view. The area in front of the sternomastoid will be the anterior triangle, while the area just behind the sternomastoid will be the posterior triangle. Again, this is the sternomastoid. This is the insertion just behind the ear, and this is the origin from the clavicle and the manubrium. The posterior triangle of the neck, as we described earlier, is the space situated just behind the sternomastoid. It's a triangular space. Any space has got some boundaries, has got a roof, has got a floor, and has got a content. So we will start describing the posterior triangle by its borders. The anterior border of the posterior triangle constitutes the posterior border of the sternomastoid. We said that this triangle is situated just behind the sternomastoid. So the posterior border of the sternomastoid will be the anterior border of the posterior triangle. The posterior boundary for this triangle will be the anterior border of the trapezius muscle. The base of the triangle is formed by the middle 1/3 of the clavicle. We said that the posterior triangle is an erect triangle with its base resting on the floor while its apex up in the back of the neck. This is the posterior triangle as we described. This is the anterior border formed by the posterior border of the sternomastoid. This is the posterior border formed by the anterior border of the trapezius. This is the base formed by the middle 1/3 of the clavicle. And this is the apex. This is the junction between the trapezius and the sternomastoid. As we said, the apex is formed by the superior nuchal line where the sternomastoid and trapezius meet and overlap upon each other. The roof of the posterior triangle is formed by investing layer of cervical fascia. We said that the investing layer encircles the neck and even splits to enclose muscles like the sternomastoid anteriorly and the trapezius posteriorly. The roof of the posterior triangle is formed by this investing layer of fascia of the neck, surrounding the sternomastoid, surrounding the trapezius as they pass through the region, encloses the platysma, superficial nerves, and vessels and lymph nodes. The muscular floor of the posterior triangle is covered by pre-vertebral layer of cervical fascia because we said that this layer of fascia overlaps the vertebral muscles, pre-vertebral muscles, overlaps the scalene muscles and the muscles of the spines posteriorly. So the floor of the posterior triangle is covered by the pre-vertebral layer of fascia, and this layer of fascia is covering a group of muscle. This group of muscle from down upward is scalenus anterior, scalenus medius posterior, levator scapula, splenius capitis. This is the uppermost muscle present at the triangle. This is a diagram for the muscular components forming the boundaries of the posterior triangle. As you see, this is the sternomastoid with both origins, the sternal and the clavicular. This is the trapezius, and these are the anterior and posterior boundary of the triangle, and this is the base formed by the middle 1/3 of the clavicle. The content of the, the floor of the posterior triangle contains 4 muscles from down upward: scalenus anterior, scalenus medius, scalenus posterior, along with the levator scapula and splenius capitis at the uppermost part of the triangle. The muscular floor of the posterior triangle mentioned earlier, the one that is formed by the scalene muscles, scalenus anterior, medius, and posterior. with the levatoroscapula and splenioscapitis. They are all covered by the pre-vertebral fascia, the one that is responsible for covering the muscles related to the vertebral column. This fascial layer, this floor of the posterior triangle, extends and comes out of it the axillary sheath surrounding the subclavian artery and branches coming from the brachial plexus, forming the roots of the brachial plexus that is present at the neck. Again, one more time, this is the muscular boundaries for the posterior triangle, anteriorly by the sternomastoid, posteriorly by the trapezius. The floor is formed by the scalenus anterior, this is the scalenus anterior, scalenus medius, scalenus posterior just behind the scalenus medius, levatoroscapula and splenioscapitis. Splenioscapitis sometimes is followed by the semispinalis capitis at the uppermost part of the triangle. The posterior triangle contains everything. It's like any other part of the body. It contains muscles, it contains lymph nodes, it contains nervous structures, veins, and arteries. But for sake of simplification, we've arranged these structures according to the actual count of these structures within the posterior triangle. Meaning that we are having one muscle, we are having two lymph groups, we're having three nervous structures, 4 veins, and 4 arteries. And these will be dealt with in details in the following slides. The first item as a content of the posterior triangle is the muscular part of the posterior triangle as a content, not as a boundaries. So as a content of the posterior triangle, we only have one muscle to be considered as a content. The muscle called omohyoid has got 2 bellies, a superior and an inferior one with an intermediate tendon. The superior belly of omohyoid is attached to the hyoid bone from its name, omohyoid, while the inferior belly of the omohyoid is attached to the upper border of the scapula and the suprascapular ligament or the suprascapular notch. So this muscle is running through the posterior triangle. And being inside the posterior triangle, it divides the posterior triangle into 2 compartments. The intermediate tendon of the omohyoid lies deep to the sternomastoid and is connected to the clavicle and the first rib by a loop of deep fascia. This omohyoid muscle is considered one of the infrahyoid muscles that is supplied by the ansa cervicalis. And as you see, if I get the insertion towards the origin, because the origin is down there in the upper limb and its insertion is in the hyoid bone, so it depresses the hyoid bone and aids in the process of deglutition, forcible deglutition. Also, the presence of the omohyoid within the posterior triangle as a content of it divides the posterior triangle incompletely into 2 other spaces. A small supraclavicular triangle that is present below, just above the clavicle, and another larger one that is present or situated just above the muscle at the rest of the triangle. Then this one is called an occipital triangle, and it's situated above. This is the posterior triangle once more, and as you see, we are highlighting the omohyoid muscle. This is the inferior belly of the omohyoid. This is the superior belly of the omohyoid. And the intermediate tendon lies in between both bellies of the muscle, just beneath the sternomastoid. If you look at the posterior triangle, you'll find that the inferior belly of the omohyoid splitted the posterior triangle into a supraclavicular triangle. This is the smaller one. And an occipital triangle, this is the larger one present above it. Again, this is the omohyoid. We have split the sternomastoid to show the intermediate tendon of the omohyoid. Now you can see the posterior triangle with its supraclavicular triangle and the occipital triangle present above. Within the posterior triangle, as we had the first component or the first content as one muscle, the second content would be 2 lymphic groups, and the 2 lymphic groups are situated within the subdivisions of the posterior triangle, meaning that we divided the posterior triangle into an occipital and a supraclavicular triangles. We will put a lymph node group in each of these triangles. So we have got a supraclavicular lymph node group and an occipital lymph node group. The following component to follow as a content of the posterior triangle would be three nervous structures. The three nervous structures starts with the spinal accessory nerve. It's one of the cranial nerves. It's actually the 11th cranial nerve. The spinal accessory nerve runs at the roof of the posterior triangle, actually embedded into the investing cervical fascia, stretching between the posterior border of the sternomastoid and the anterior border of the trapezius. The nerve comes into the posterior triangle by piercing the posterior border of the sternomastoid a little bit above its middle part or middle of the posterior border. In this case, it's related to the lymph nodes of the upper deep cervical chain. The significance of the presence of the spinal accessory nerve within this part of the neck that the spinal accessory nerve can be damaged in operations requiring the removal or biopsy of lymph nodes in the posterior triangle of the neck. And by its injury, there would be paralysis in both muscles supplied by the spinal accessory nerve, the sternomastoid and the trapezius muscle. Both will be paralyzed. This is the transverse process of the atlas. This is the course of the spinal accessory nerve. Here it crosses just below the sternomastoid, and this is the middle of the posterior border of the sternomastoid, where it starts entering the posterior triangle in close relation with the upper deep cervical lymph nodes. The second nervous structure within the triangle would be the cervical plexus. The branches coming from the cervical plexus form the second nervous component within the triangle. The cervical plexus forms within the muscles of the floor of the posterior triangle. A major branch of this plexus is the phrenic nerve. The phrenic nerve rises from C3 to C5 and descends down through the neck to reach to the thoracic cage, where it supplies the diaphragm. Other branches of the cervical plexus innervate the vertebral muscles and provide cutaneous innervation to parts of the neck and scalp. These include the greater occipital nerve. This is a branch coming from the posterior ramus of C2. C1 has no cutaneous branches. What's left of the branches of the cervical plexus emerges from the front and sides of the neck. They are the anterior rami of the cervical nerves from C2 to C4 through the branches of the cervical plexus. These branches are the lesser occipital, the great auricular nerve, transverse cervical, and suprascapular, and they are all having the root value from C2 to C4. All these nerves, the four cutaneous branches of the cervical plexus, along with the spinal accessory nerve, they all emerge and exit into the posterior triangle through the junction between the upper and middle one-third of the posterior border of the sternomastoid. So this particular place is of clinical value in nerve block procedures. If someone is having severe pain or a surgical procedure that has to be done through this area, this is the optimum point for injecting local anesthetic that controls all the content of the triangle, the muscular component through the spinal accessory nerve and the cutaneous component through the branches of the cervical plexus. The last component of the nervous structures, we said that the muscles, there is one muscle and there is two lymph node groups and there is three nervous structures. The third of the nervous structures would be the roots and trunks of the brachial plexus. And through the roots and the trunks of the brachial plexus, we might encounter branches coming out of these roots and trunks, namely the dorsal scapular, the long thoracic nerve to subclavius, and the supraclavicular nerve. This is the posterior triangle once more. This is the base formed by the middle one-third of the clavicle, posterior border, anterior border. This is the junction between the upper one-third, middle one-third of the posterior border of the sternomastoid. This is the point of exit between the nerves that pass and considered to be a content within the posterior triangle. I've got a motor nerve coming from the sternomastoid to the trapezius. This would be the spinal accessory, along with the four branches coming from the cervical plexus, lesser occipital, greater auricular, transverse cervical, and suprascapular. If I inject a local anesthetic agent at this point of nerve block, it would block all the nervous content of the posterior triangle. Again, this is the supraclavicular, this is the transverse cervical, great auricular, and lesser occipital nerves. This is the omohyoid, and in this particular picture, I am seeing the third component of the nervous structures. This is the roots and trunks of the brachial plexus, along with the extending nerve between the trapezius and sternomastoid. This is the spinal accessory nerve. Another view for the posterior triangle after exposure. You're seeing here that the base of the posterior triangle has been removed to better show the content of the posterior triangle. We're highlighting the nervous structures. We have got 4 nervous structures: the spinal accessory nerve extending between the muscles, the 4 branches of the brachial plexus, the cervical plexus, the lesser occipital, great auricular, transverse cervical, and supraclavicular nerves, along with the roots and trunks of the brachial plexus and the nerves coming out of it. The next content of the posterior triangle would be the arteries of the posterior triangle. We've got 4 arteries. We've got the transverse cervical artery. It's a branch coming from the thyrocervical trunk, which is coming from the first part of subclavian artery, enters the posterior triangle laterally and upward, crossing the scalenus anterior, upper trunk of brachial plexus, and the scalenus medius. The suprascapular artery is also a branch of the thyrocervical trunk. It enters laterally and backward behind the clavicle to get to the upper border of the scapula. The third artery to appear in the posterior triangle as part of its content is the dorsal scapular artery, coming from the third part of the subclavian. It enters laterally in front of the scalenus medius and the brachial plexus to get to the superior angle of the scapula. It runs to the posterior aspect of the posterior triangle deeply to reach the upper border of the scapula, and from it reaches to the back of the scapula, supplying its muscles. The occipital artery, the fourth of the arterial content, it's a branch of the external carotid, crosses near the apex of the triangle, superficial to the semispinalis capitis. Whereas for the subclavian artery, it's a large artery present at the base or near the base of the posterior triangle, entering behind the scalenus anterior over the first rib. It's also closely associated with the lower trunk of the brachial plexus. This is a diagram for the vessels of the neck, especially the vessels of the posterior triangle. We have removed the sternomastoid. These are the scalene muscles, scalenus anterior and medius and posterior. As you see, this is the subclavian artery present at the bottom of the triangle, just behind the scalenus anterior, and we are having 2 other branches running within the posterior triangle, the transverse cervical and the suprascapular artery. In another cross-section, another view, you can see the transverse cervical artery, the suprascapular, both are coming and reaching towards the back of the neck and the back of the upper limb to reach for the scapula posteriorly. For the venous structures present at the posterior triangle, we've got veins that resembles the artery in some part and the other that are new veins present at the area. From the veins that are not equivalent to similar arteries, we've got the external jugular vein. We mentioned it earlier in the superficial fascia of the neck. We mentioned that it starts by the posterior auricular and the retromandibular nerve. It runs upon the sternomastoid till the lower part of the neck and the base of the posterior triangle, where it pierces the deep fascia to drain into the subclavian. The suprascapular and transverse cervical, they both join the external jugular vein in the inferior portion of the triangle. The internal jugular vein courses deep to the sternomastoid and is susceptible to injury during dissection of the posterior triangle of the neck. This is a clinically important issue concerning the sternomastoid. We said that the posterior border, the junction between the anterior, upper, and middle 1/3, has an anesthesiological importance because we can induce a nerve block at this area to control the muscular component and the sensory component of the posterior triangle of the neck. Also, we've got a vein at the outer surface of the sternomastoid, the external jugular, and another main vein just beneath the sternomastoid, the internal jugular vein. This is a diagrammatic representation for the structures present at the front and sides of the neck. As you see, this is the external jugular. As you see, it's coming from the outer surface of the sternomastoid, appearing at the lower part of the triangle, and then piercing the deep fascia to join the subclavian. We see now that the external jugular vein is being joined by the transverse cervical and suprascapular, both coming from backward to join this external jugular at its lower base. Again, the same picture. This is the external jugular. These are the tributaries, suprascapular and transverse cervical, and along with the branches coming from the face and other parts of the neck. For any questions, for any inquiries, please kindly contact at any time, and I'll answer all the questions as soon as possible. Thank you.